Today is Maternal Health Awareness Day. Now, the goal is to make more people aware of the maternal health crisis happening in the U.S.
Addie Miners tells us more about the crisis and what one local hospital is doing to address the issue.
When compared to other high-income countries, the U.S.'s maternal mortality rate is 3 times higher. Baptist Health nurse Kelly Gardner says most of those deaths could be prevented. According to the CDC, about 700 women die each year in the U.S. as a result of pregnancy or delivery complications, and nearly 2/3 of those deaths are preventable. Additionally, March of Dimes' 2022 report shows the infant mortality rate in the U.S. is around 5.4 deaths per 1,000 births, and in Kentucky, that average is even higher.
We're at 6.2 currently. Our preterm birth rate is 12%. Which gives us an F if we're going to grade this.
And the numbers are even worse among minorities. In Kentucky, the infant mortality rate for Black babies is almost double the state's average, followed by Native American and Hispanic infants. Elizabeth Pabon, a mother and baby nurse at Baptist Hospital, says most complications are caused by mothers not seeking prenatal care.
So some mothers don't seek help because maybe they're scared, or if they don't have any family or friends to ask questions, where do they go? A lot of that starts with education. So that's why Baptist offers all of these education classes.
Last month, Baptist started offering a 2-hour class on maternity care in Spanish.
Coge unos cuantos días, pero podemos.
In an effort to reach more expectant mothers.
So moms are being educated on complications that could happen during pregnancy, even after they have their babies, what to look out for.
Classes are held both in person and online. Pabon, who helps run one of the classes, says the work is rewarding.
They just put a smile on their face and they feel more comfortable just asking questions that they need to know about themselves, the baby, what's going on.
Addie Miners, WLKY News.
And registration